Gwen Sawicki. Gwen graduated from Saskatchewan Polytechnic and the Western Institute of Applied Arts and Science with a diploma in dental therapy in 1987. She received the Dr. W. F. Johnson Memorial Award and the Guinea Pig Club Canadian Game Award for her achievements. She worked with ESI practice in the office for 26 years and then for 9 years with the former Saskatchewan Health Region and Saskatchewan Health Authority as a senior dental therapist. In 2016, Gwen was presented with the Bravo Award from the Saskatchewan Health Region for excellence in developing virtual online dental resource kits. Currently, Gwen is in an interim position as Clinical Integration Manager for Primary Health for the Saskatchewan Health Authority. She has found her work in public health to be the most rewarding and fulfilling of her career. When she's not at work, Gwen enjoys gardening, camping, scrapbooking, traveling, reading, and spending time with her husband, daughter, son-in-law, and grandpuppy. Gwen.
Good morning, everyone. Good morning on this blustery day. I have to say you're very fortunate in Saskatchewan. I live in Humboldt, we have way more snow, way more ice. I literally went out of the driveway into the street and it was waist high, like we were snowbound. We still pretty much are, but I managed to get out with our four-wheel drive truck this morning, so I'm here. Has anyone ever heard of the Guinea Pig Club? Yes, and this is one of I had the plaque on the wall when I worked in private practice, and I mean, it was one of the most frequent asked questions. What is that? So does anybody here remember Dr. Lionel Hastings? So probably not many of you, maybe Leslie. Hey, okay, a few less. So that dates me, of course. So he was a Second World War veteran, and he was in a bad plane crash. He actually had over 30 bones broken in his face. His back was broken in 3 places. I think he had a broken leg. And so at that time, because there were so many plane crashes, explosions, that happened during the Second World War, a lot of the injuries that were sustained by a lot of the men had never been seen before. So there was some very cutting edge plastic surgeries that went on that we would consider barbaric nowadays, but at that time they were cutting edge procedures. So he was treated in one of the hospitals in England. The Canadian government actually built a wing of this hospital, and he was one of the men treated in that wing. And this is a group of men who, after the war, got together, called themselves the Guinea Pigs, and called themselves the Guinea Pig Canadian Wing Association. So that is where the award is based on. And actually, right around this time of year, there's often documentaries, and there's actually a really good one on the Guinea Pig Club. And if you kind of watch for it, it often comes on the History Channel. And it's really, really very interesting. Some of the things that they would do is they would actually slice the skin on the arm and sew it to the face to allow the skin to grow so they could make, say, a nose. Sometimes they would just put weights on the skin on the face to expand it enough so that they could do plastic surgery. So it's really very interesting. If you ever see it on TV, it's a really good one to watch. So a little bit of history for you this morning. All right, so I'm here to talk about the Children's Oral Health in Saskatchewan. And I am going to just briefly touch on the important things. There is the document at the back if anybody would like to read it. Really great bedtime reading. So it is interesting, but it is fairly in-depth with lots of charts and graphs. But I know we're getting close to dinner time, and I don't want anyone rushing the podium because they're hungry. So we will get started. And if Leslie has broken the mouse, I will get you into the forward. We'll see, we'll see.
Just left click it. Just left click it. Put it down.
Just left click it. That's the, okay. All right, so this is our, I work for the Saskatchewan Health Authority, so this is our vision, our mission and our values, and our philosophy of care is our commitment to philosophy of patient and family-centered care is at the heart of everything we do and provides the foundation of our values. Our land acknowledgement, I will do that as well. We would like to acknowledge that we are gathering on treaty currently right now 6 territory and the homeland of the Métis. Recognizing this history is important to our future and our efforts to close the gap in health outcomes between Indigenous and non-Indigenous peoples. I pay my respects to the traditional caretakers of this land. So currently, I guess the studies were done, our screenings were done on all treaty territories 2, 4, 5, 6, 8, and 10. So a little bit of a background about the Children's Oral Health Report. So this was completed in 2018-2019. The dental health screening program started in 93-94 following the end of the Children's Dental Plan and the Saskatchewan Health Dental Plan. So the purpose was to maintain health surveillance, monitor the oral health status of Saskatchewan children, identify unmet needs, and refer children for treatment. I'll just get you to
Okay.
You're doing a good job. When the dental plan began in 1974, the oral health of children was very poor. The average 6-year-old had 6.5 decayed teeth. And if you think that is a lot of decayed teeth, when those little mouths usually only have 20 to 24 teeth. This declined to 2.78 at the end of the Saskatchewan Dental Plan and to 2.69 at the end of the Children's Dental Plan in 93. And I have to say those slides were really interesting. Leslie was one of the first graduating members of the class at Wascana, and I was I was the second last. So she started it, I shut it down pretty much. So not something I'm proud of. So at the end of the Children's Dental Plan, the once every 5-year dental screening was implemented. And over the past 6 screenings, the oral health of 6-year-olds has declined. In 93-94 school year, a 6-year-old had 1.9 decayed teeth. By 2018-19, this has risen to 3.65, and we are not meeting the Canadian Oral Health Framework goal of 2.7 decayed, extracted, and filled teeth. So in 1974, 12% of 6-year-olds were cavity-free, which means about 88% of them had dental disease or cavities. And this improved to 39% at the end of the dental plan and to 50% by the end of the Children's Dental Plan. The Children's Dental Plan did not provide services to the same volume of children that the Saskatchewan Dental Plan did, and so that needs to be taken into account when we're talking about percentages. And again, over the 25-year span, of the 6 dental screenings, the percent of Saskatchewan 6-year-olds who are cavity-free has declined from 57% to 40.5% in 2018-19. And this is well below the goal of the Canadian Oral Health Framework goal of 55%. So a little bit of background here. So the selected populations and ages are determined based on the Canadian standards and this Canadian Oral Health Framework guide. So the screenings were provided by dental therapists and dental health educators. So the screenings involved visual screening using an LED flashlight and a mouth mirror. We sent letters home to the parents. The schools were informed, the schools informed the parents via electronic school newsletters or sometimes paper. Data was entered into a database for analysis, and screenings were conducted from September of 2018 to August of 2019. So this was the form that we used, so just minimal information on it. And a few questions. So we did ask a few questions of the parents to send back to us, and that as well was all put into the database. This was the letter that went home. So after we saw the children, all of our findings were put onto this letter. So parents were always informed if we did see anything of concern, that they then were able to access care for their child to get their dental treatment done. And the back side of the form, so we always like to include a little bit of information about good oral habits of brushing and flossing, as well as the options of our dental clinics in Saskatoon that they could go to have any treatment completed. So the former health regions and the percent of children screened, this is a nice little chart of the different colors showing the number of kids screened. The majority were screened in the Saskatoon health region. So we worked hard at Saskatoon, right? I know everyone works hard. This is a really huge undertaking for everyone in the province. We run full tilt on a regular year, let alone having screening done. So it is a really, really busy year to add this extra work for everyone. So the majority were screened in Saskatoon with 32.5%, followed by former Regina and Coppell, and then the lowest in the Keowani, nothing. So some charts again with a few comparisons. So 80% of all grade 1 and 7 children were screened in Saskatchewan. Of the 12% not, and that's a phenomenal number considering we are seeing every grade 1 and every grade 7 child in the province. So of the 12% not screened, the majority often were away during the day of screening or sick and not in school. So it's important to note that there was a 25.4% increase in the number of children screened, and 14.92% of all eligible schools were screened in 2018-19. And so due to the significant number screened, the results of the population over the survey overall is really accurate because we saw a lot of kids that year. So the mean average age has remained constant through the 6-year screening cycle. So about 6.6 and about 12.6 years of age in grade 1 and grade 7. So we often kind of do talk about that interchangeably. The grade 1s, grade 7s, and 6-year-olds and 12-year-olds is what we'll often refer to. So the data is used to target services to communities in which the Canadian Oral Health Framework goals are not met. So if we have a school where the school falls below the comparison to the statistics from the Canadian Oral Health Strategy Framework, if they fall below those standards, then prevention programs are put into those schools that then become our high-risk schools. So that can change every 5 years of schools, the number of schools that we go into. So early childhood tooth decay, we'll talk a little bit about the definitions of some of the things that we are seeing. This means the presence of one or more decayed, missing, or filled teeth in primary teeth in a child 71 months of age or younger. Severe early childhood tooth decay, so any sign of smooth surface caries in children younger than 3 years of age. From ages 3 to 5, one or more cavitated, missing, or filled smooth surfaces in primary maxillary anterior teeth are decayed, missing, or filling score. And I'll let you read all of it there. It's all, yeah, it's hard to explain unless you're sitting looking at all of the statistics. So that's why this is a really good thing to have beside you when you are looking at all of this. But anyways, yes, so the early childhood tooth decay and severe early childhood tooth decay. So the status of early childhood tooth decay and severe early childhood tooth decay actually remain quite similar when the comparison is made between the last 2 years of the screening. So priorities, we do put the data into priorities. Priority 1 is pain and infection is present and urgent care is needed. Priority 2, early childhood tooth decay or severe early childhood tooth decay, visible decay in 1 to 4 quadrants, and treatment is required as soon as possible as well. And priority 3 is no visible decay. So DEF and DMFT, so decayed, extracted, and filled. And that is grade 1 versus grade 7. So these are a few more statistics. Again, really nice graphs that were done up here. A little too much detail to go to, but one thing of note is the 33% of 6-year-olds have 7 or more decayed deciduous teeth, and that's quite alarming when they have just those little mouths of just most often 20 teeth yet at that age. So when we talk about permanent teeth, or moving on to the grade 12s having mostly permanent teeth, decayed, missing, and filled teeth, and the effects there. So 38% have 1 to 6 decayed permanent teeth. And that as well is quite alarming, because those teeth, I always tell children when I see them, they're going to have those teeth till their grandmas and grandpas. So those are not teeth that are going to fall out, not easily repaired if there's pulpal involvement. So again, quite alarming statistics. So the no decay experience, just a little bit of explanation about this. So no decay experience, the NDE, no evidence of care, NEC, partial caries care, ECC, and complete caries care. So again, those are statistics from the 2013 to 14. A little bit of a change, but not anything hugely drastic there. Next slide. Reducing Dental Disease, a Canadian Oral Health Framework report. So the second National Oral Health Framework document produced by the federal, provincial, and territorial dental directors and dental consultants. The Saskatchewan Oral Health Status data was analyzed, and under 2 of the oral health status goals were improving the oral health of children and youth. And access and care is also important to improve the oral health and access for Aboriginal people. And I am saying Aboriginal people because that's the language used in the document. So you will hear me refer to Aboriginal people again later. So, checking one right slide. So reducing dental disease. So the document, so the framework identified challenges in 7 categories. Improving oral health, access to care, oral health policy, surveillance, health protection, oral health promotion and disease prevention, and leadership and workforce. We'll talk a little bit more about that. So under improving oral health, the age 6. So these are our what we base our analysis on. So the DEFT or DMFT of less than 2.5 for 6-year-olds, 55% of 6-year-olds are cavity free, and the less than 15% of 6-year-olds have a DEF or DMFT greater than 0. For the age 12, the DMFT of less than 1 for 12-year-olds, greater 70% of 12-year-olds having a DMFT of 0. And also, there is a separate area that we were for analysis, and this is improving the oral health and access for Aboriginal people. So under that area, it is the goals of 50% of First Nations and Inuit schools provide school-based prevention services. 15% of First Nations and Inuit children who are 6 years old are cavity-free, and 20% of First Nations Inuit children who are 12 years old have a DMFT equal to 0 or 0 cavity-free in permanent teeth. So leadership and workforce in each province has a full-time, yes, so this is the goal, that each province has a full-time health director with formal training or possessing special skills in dental public health. Each government, which is federal, provincial, and territorial, establishes a formal oral health plan that identifies problems, establishes goals, and determines strategies to achieve goals and monitor outcomes. So as well as the DEFT and DMFT, we're also looking at other areas of the mouth. So some of those are malocclusion or a poor bite, we could call it. Staining on the teeth, gingivitis, or gum disease, and calculus. So on these charts, these are really quite interesting as well. Couple things to note, the 23.5% of 6-year-olds with malnutrition. So already at that age, we're seeing poor bites developing, and 24% of 12-year-olds with gingivitis. So at 12, you're seeing already that gum disease is prominent. And so, of course, we all know as we age, how that can affect our overall health. So to me, that's quite alarming that we see that many kids already having gum disease present. So goals met. The goal met for the last and the current dental screening. So this is the First Nations school-based preventive programs. So nearly all of them had school-based preventive services in them, which is really wonderful. And this is due to the Indigenous Services Canada and the COHI program that has been implemented there. And COHI is the Children's Oral Health Initiative. And in, again, the Aboriginal 6-year-old outcomes and a comparison between the last two screenings there. So the goal is met again for the improving the oral health status of 6-year-olds entering school. And so the goal met in 2013-14, but not met in 2018-19, and that there was about a 5% decline in that area. So improving the oral health status of 12-year-old children, and the goal was met in both years, not too much of a change there, so from 31.65% to 30.4%. And again, the DMFT and DEFT there, talking about fluoridated versus non-fluoridated communities. And again, looking at the province, the Saskatoon urban has 94% of population with access to community water fluoridation due to the fact that we have it's treated here in Saskatoon, as well as the pipeline reaches out to the east part of the province. And once it goes to, I think it's the Waka water treatment plant, it's fluoride is added there as well. So I live in Hamilton, we are lucky to have access to that fluoridated water there. The lowest percent is Regina. However, that is set to change because they will be fluoridating their water. So fluoride in Regina, that's a huge milestone. Huge thing that is going to change for us there. So it'll be interesting once that's implemented, if we'll see some differences in the screenings down the road. I'm sure we will. I'll be retired by then, I'm just saying. Or maybe not if I follow Leslie's footsteps. Anybody who knows Leslie knows she did, 50 years, like, oh my goodness, Leslie, that's wonderful. I don't know what we'll do without you, but we will try to carry the torch. So Saskatchewan, the comparisons, so the DEFT and DEF, it's kind of a tongue twister, DEFT and DMFT. So the comparisons in the urban and the rural, so there hasn't been too much change in the last two screenings there. Rural children seem to have a higher level of complete care than urban. Even though the children in rural tend to have a higher level of treatment required. Children with no dental home or family dentist score the worst on all oral health indicators, and so clearly it's really very important to have a family dentist, and it's often one of the things that I find when I was working in the program, in our oral health program, that access to dental care is so difficult for so many people, and it might be travel, it might be cost. There's a lot of factors that are involved there, and it's one of the things that I think we spend so much time on is trying to help families gain access to a family dentist. Very time consuming to do that. So the network, Canadian Oral Health Framework data from the Northeast area is green. You'll see that indicates an improvement from 2013 to 14 with the goal met. So you'll see the dark green, and then the red is not having been met. So the Northwest area If I read all of these, we won't be eating until supper time, so I will, again, if you would like the report, it's at the back, so. But some interesting data there for sure. So the Regina area, the green indicates improvement actually from the 2013-14, like the Google map there. And the Saskatoon report. Lots of red, which is sad to see, but it is what it is. Southeast area, southwest area. When we look at the province as a whole there, so the average EFT DMFT score of less than 2.5 by former health regions there. So 2018 to 19, so you can just see the comparisons there of the different colors. So the average, sorry, yeah, thanks, Nina. The average DEFT DMFT score, oh, sorry. This is the old former health region. So the former Saskatoon, Regina, Coupal, so on. So the comparisons there, 2013 and 2018-19. And the same there for 12-year-olds, the comparisons. How long did the charts take, Leslie, for them to come? They're wonderful charts. Like months to do this? No? I just think they're just so wonderful to have. So the dental health of students and the percent with pain by former health region in 2018, 2019. Percent with no evidence of dental care. That's the dark purple there, 25.8%. And the recommendations of the oral health surveillance, so continue ongoing oral health surveillance for selected populations as required. Fluoridation, we all know fluoridation is so important, so healthy public policy at provincial and regional levels to support the consistent optimal fluoridation at 0.7. A lot of times we're seeing, especially in Saskatoon, that they're fluoridated, but maybe not in the optimal level. So it's something that we track and watch here. So targeted schools continue oral health standards of care for fluoride varnish, dental sealants, and dental sealant retention checks to prevent and reduce dental decay for children in grades 1 and 2, targeted to schools not meeting the Canadian Oral Health Framework 2013-2018. Indicators, and just looking at the PP there, and Leslie had slides of no PP. I think we were one of probably the first or second groups to start using gloves and masks and PPE. However, at the stage that I was at when I trained, it was actually still optional that we could use it. We actually could wash our gloves, and that was considered okay. And like that, you think of that and just think, oh, right, it's actually disturbing. But at that time, we didn't know any better. So recommendations for high-risk communities: continue oral health standards of care for children aged 0 to 6 through fluoride varnish, and dental surveillance at high-risk daycares, preschools, pre-Ks, and schools in core city areas and communities with children at high risk dental disease. Exploring fluoride varnish training. So explore training other health professionals to apply fluoride varnish. So in Saskatoon Urban, we will eventually be training our public health nurses. It's something that has been approved at the medical health officer level. It's just, we were just set to start training public health nurses to deliver fluoride varnish and COVID hit. And so it's still something on the radar. Hopefully it will happen, hopefully in the next year. Once public health, they're really behind with immunizations due to the wonderful COVID that hit us. So hopefully, as soon as they catch up, we will start that training. We have been training casual public health nurses as they come into the system. So some of those public health nurses are delivering fluoride varnish. However, it's not very many, because they do just work casual right now in a lot of the public health immunization clinics. So So early childhood oral health, provide free consultation checkup for children age 1 to support Canadian Dental Association policy for the first dental visit at age 1 or first tooth first visit is often a good thing that we like to say, very easy to remember. Public health nurses in all health regions provide dental assessments at child health clinics at ages 6, 12, 18, and 4 years. So that is something that does happen now. Even, it did kind of take a pause during COVID, but I think most public health nurses have started that again. So it is just a look, but at least it's a look, and anything that they see, they can talk to the parent about referrals, or at least, and it's not so much about diagnosing, it's just seeing something out of the ordinary and encouraging the parent to have it checked out to see if there's anything that needs to be taken care of. High-risk populations again, so exploring opportunities for prenatal women to have a free consultation, dental screening, and dental treatment. Every once in a while, we do see at-risk moms in our dental clinic at the Western's Primary Health Center. We sometimes get women referred to us from some of the programs that run in the area there. And so it's something that needs to be done more often than not often enough. Because there's a lot of high-risk people out there. So anyways, providing oral health education for high-risk populations with an emphasis on pregnant women and their families. And I did in my therapy role a lot of presentations for some of the mommy groups in Saskatoon. And they were always so very grateful, and they always came away learning something, even though we think we're doing a great job of educating people in the province with oral health, but we can always do better. And so those are some of the groups I think that were most grateful, and teaching moms about what to look for with their babies, even just lifting the lid, something that simple is so important when you're a new mom or a new caregiver, any kind. It could be dads too. So vulnerable families, extending that insurance to coverage policies for vulnerable children and families, including preventive and treatment services targeted to those with low income who are not eligible for supplementary health or family health benefits. And those are our two programs that do cover a little bit of dental care in Saskatchewan. Another one would be expansion of dental public health clinics in Saskatchewan to serve vulnerable populations with no access to care. So currently in the former Saskatoon Health Region, we have the 2 dental clinics in Saskatoon that we can refer anyone to, and they can have their 18 and under can be referred to this clinic and have their treatment done at no cost. So we have a clinic at the Western's Primary Health Center and the White Buffalo Youth Lodge as well. And so there's certainly a need for more of those in Saskatchewan. As well, there are, I think, several in the north of those clinics as well. So for the full report, it's an online, Leslie, right now. Right. Yeah, so there are printed copies on the Saskatoon Health Region website, and that will be changing, and hopefully it will be printed on the Saskatchewan Health Authority website when we go to that. All right, I went through that very quickly, but it does give you a little overall view of the work that was done on the screenings. Does anyone have any questions? Right, well, thank you so much. Thank you for not rushing me up here with wanting to eat. So I will turn it back to you, Shelby. So